Good evening, everyone. Good to see you all back. I'm Dr. Ashok Kumar, Senior Consultant Intervention Cardiologist from Raila Hospital, Chennai. Uh, Today, for the next couple of minutes, probably I'm going to discuss with you all about what routine changes should a cardiac patient adapt after getting discharged from hospital. Then subsequently, let me take questions from you all. We cannot generalize the discussion for everyone because each cardiac patient fits into his own category. So it's a spectrum. So, but for the sake of, for benefits to everyone, let me put it, as two or three different verticals. Maybe for cardiac patients first, common cardiac patients, common procedure that cardiac patient undergoes is coronary angiogram. That's a diagnostic test in the interest of identifying a block, especially if somebody suffers an attack. Cardiologist does a test from the radial artery, putting a sheath here, pass a catheter, inject a dye, take a snap of how good the blood supply to heart is, and identifies the blocks, and that's angiogram. So angiogram as an elective procedure is usually done as a daycare procedure, and after procedure, for a patient, somebody will be observed for a couple of hours, then get discharged. So for them, routine changes, routine adaptations would be if there is no significant disease and doctor advises only medical management, they can get back to the routine works from the very next day. Should not be a problem. Only thing is, after discharge and then for the overnight, actually, somebody should be cautious about bleeding actually because there could be a bleed and there could be a bleed from the site where angiogram is performed. Commonly, angiogram is performed from the hand, and sometimes it can be done from the groin as well. So there should be limitation in the movement of the limb where through which the test is performed for next 12 hours. So that helps in preventing the bleeding and that helps in getting the arresting the clot. So this is this is the common thing that routine changes or routine things one should be careful about after getting angiogram done. And the second common procedure that cardiac patients would undergo is coronary angioplasty, or in easy terms, getting a stent implanted. So, as discussed in angiogram, cardiologist identifies how good the blood supply for the patient is and how many number of blocks or how severe is the blocks. And during coronary angioplasty, these blocks are fixed with stent. Initially, a balloon is done, so the blocks are pushed aside, and the blood flow gets restored. And to prevent this block from reaccumulating, stent, a mesh-like material will be placed, that is stent. So this is coronary angioplasty or stenting procedure. After stenting procedure, usually patient will stay in hospital for a couple of days, a day or two, and then get discharged. So if it's done as an elective procedure, assuming if somebody's heart function is normal or pumping is normal, they can get back to routine level of intense activities within a week. And not and their advice are not to exercise, not to do heavy exercise, especially intense isometric exercise. And routine changes in food include should not take excess deep fried foods, should not take sweet enriched foods, and should have a salt contained foods. So preferably, yeah, three yes: salt, sweet, and saturated fats to be in moderation or to be in control. So, but if in case somebody has underwent angioplasty for a major procedure, for a major problem like heart attack, there could be a dip in cardiac function there, because we assess it with ejection fraction. If there is a drop in the ejection fraction, so the pumping will be low, and when the pumping is low, they are likely to suffer more events in the near future. So they should be a little more cautious and careful. They should have a contained or restricted physical activities at least for the next 3 months. They can perform, they can walk around as and when they're comfortable, they're not symptomatic, they can walk and do such a routine household activities, but they should limit intense level of physical activities. And the food restriction or food, the type of food modification goes the same. that is restrict salt, sweet, and saturated fats, and moderate the calorie content intake as well, and limit alcohol intake, and cut down on smoking or avoid smoking if somebody is a smoker. So these things. Apart from that, more importantly, doctor gives a prescription, out of which first two will be a blood thinners, which are vital for somebody's survival after having angioplasty done. They prevent stent from getting clotted. So if a stent gets clotted, the chances of losing a life is about 25 to 40%. So that's very high. So stent should not get clotted. To prevent stent from getting clotted or stent from getting blocked, doctor will give a blood thinners, which are vital drugs. One should not neglect, or one cannot afford to ignore it, the drug even a single day or a single, I mean, even a single dose as well. So that caution should be exercised after getting angioplasty done. And these blood thinners are really vital for 1 year. After 1 year, doctor may de-escalate the dose and de-escalate the number of pills, suiting tailored to the patient. So these are the important do's and don'ts. I mean, among don'ts, no intense physical exercise, no isometric exercise like resistance exercise or weightlifting exercise, muscle building exercise. Better, preferably not done after an angioplasty, at least for a couple of months. And yeah, isotonic exercise somebody can gradually start after a month, preferably after a month. Isotonic exercise include walking, jogging, going and doing a treadmill or elliptical. Such things can better be done again, preferably after 4 weeks, or that is after 1 month. So these are like do's and don'ts for angioplasty. Then the common third common discharge from hospital from a cardiac patient is heart failure. In fact, this holds the most majority numbers. They may or may not have undergone a procedure. Heart failure could have been managed with the medicines alone. Heart failure could have been managed with angioplasty and stenting, or heart failure could have been managed by some other procedure like a pacemaker, or devices like intracardiac defibrillator, which is similar to getting a pacemaker implant on the chest. So in either way, patients are managed. In either way, in either case, be it managed medically or with procedures. End of the discharge, again, three cautions I would mention for heart failure patients. One, be disciplined with the drugs. Drugs are very vital for survival and preventing recurrent hospitalizations. Again, missing a dose for a day or two will certainly increase the probability of recurrent hospitalization and even sudden deaths or sudden cardiac arrest at home. So very essential that drugs to be taken disciplined way, and not even a single day one can afford to miss out on the drugs. And then the next don'ts are no salt or avoid salt enriched foods. This is a high must for a patient with heart failure. So because salt enriched food will increase the possibility of landing with recurrent admissions and recurrent heart failure events. So no salt, strictly avoid salt, and moderate the quantum of fluid intake. So fluid intake should be like probably depending upon which what extent the heart failure and what extent the severity of underlying heart problem is. Doctor would advise not to exceed certain quantity, maybe one and a half liter, depending on the patient. And what I probably recommend is don't exceed the water consumption beyond your thirst level, or do it only when the thirst arises. Don't do it as a routine for a heart failure patients, because excess water intake will also lead to worsening heart failure and inviting recurrent admissions and recurrent events for heart failure. Second, and then next thing is avoid over-the-counter pills, be it for small minimal ailments, fever or cold, or any other minor issues. Probably even every one of us may have a tendency to take over-the-counter pills, especially paracetamol or any painkillers. And these painkillers are notorious for worsening heart failure and inviting the problem of recurrent admissions for heart failure. So, I mean, better not to take over the counter pills. I mean, any issues, better go consult a physician or a cardiologist and get appropriate treatment. And then, for all the patients, I mean, be it post coronary angioplasty, angiogram, or heart failure, do a regular visits or as advised by your physician and cardiologist, and make sure, yeah, all your parameters are taken care. your drugs are suiting you. I mean, that's for the physician to take care, but make sure you are disciplined with your consultation. Make sure you're disciplined with your drug consumption without affording to missing on consultations and without affording to missing on drug dosage consumption. And one more thing that I would emphasize for heart failure patients is, avoiding the possibility of contracting infections, because any infection in the body will trigger the possibility of worsening heart failure, inviting recurrent admissions for heart failure. So, as far as possible, try to be in a hygienic environment and prevent possibility of contracting infections. That helps, because infection per se would end up in white heart failure, or antibiotics or any other drugs that's given to treat infection would also invite the possibility of landing in heart failure. So better to avoid contracting infections. And patients with advanced stage heart failure, make sure you get a vaccination for pneumonia and influenza annually, especially when if you are elderly 60 plus. Make sure you get the vaccinations done, and I'm sure your physician would be is the right one to advise you on that appropriately. But be disciplined and get the vaccinations done. So to generalize or to summarize, cardiac patients after discharge, especially if a procedure is done, make sure for the next couple of days limit activities and that particular limb where the procedure is done, to prevent bleeding or any blood clot or any other complications from happening in that limb. And any avoid missing out on the dosages of the tablets to be taken, because even a single day missing out on a single day blood thinner is also could also invite a catastrophic event, to the extent of taking right away by clotting the stent. So drug discipline is very very important, and follow up discipline with a cardiologist, and making sure that you are on right track and getting the appropriate dosages and suiting your blood profile is also important. Avoid over the counter pills for some other minor ailments. Preferably get it done under the guidance of physician or a cardiologist, and be in a hygienic environment, prevent infections, and avoid salt, avoid sweet enriched foods, avoid saturated fat, that is deep fried foods, grossly, that takes care. When things are fine, comfortable, slowly start doing good physical, isotonic physical activity, that is walking and jogging, or doing elliptical or treadmill, suiting your body conditions. Gradually enhance the level of intensity of exercise that you do. Do it. Make sure you do it at least 20 to 30 minutes a day, at least 5 days a week. So follow heart healthy lifestyle. I mean, adopting all these measures, all doing all these, and probably would help you. You to keep you away from the cardiologist or away from the physician for a good time, for a quite a good time. So that's it from me. If any questions from the audience, I'll be happy to take them. How long can it take to become completely normal, stopping medication? It all depends again on the underlying condition that you have. If it's a minor ailment, probably the number of dosages or pills may go down or may get minimized. So if it's a major ailment, probably one would require medication for life. So if you got angioplasty done for having a block in the blood vessels, probably you would require medicines for life. But certainly the number of drugs and the intensity of drugs will come after a year of procedure. And more importantly, following healthy lifestyle will help in cutting down on medication, be it diabetic medication, be it hypertension medication, be it medication for cholesterol regulation. The intensity and the number of drugs may come down. So more first and topmost priority is risk factor modification by adopting a heart healthy lifestyle and avoiding risk factors like smoking and sedentary lifestyle. So that helps in reducing the quantum of medication and dosages of medication. Yes, there is a possibility of becoming near normal. What is my risk of having a cardiovascular problem again in the future? Yes, for somebody who suffered a heart attack, the chances of then suffering a recurrent attack is quite high, especially in the first 3 months, and the risk actually starts getting better after with time. So it is very high in the first 3 months, then slightly high, slightly lower for the next 9 months. That's 12 months, and post which the risk is even low. But again, the role of mitigating the risk is certainly not just with the pills as given by physician, more with the patient per se in having yeah, in having understanding and adopting a healthy lifestyle, which we have been discussing all the while. Can we do heavy exercise in the gym? Now, all of a sudden, doing heavy exercise will certainly invite problems. So, I mean, recent examples, I mean, just for the sake of it, I mean, mm, the Kannada actor who is quite well known suffered an arrest, not suffered an arrest after heavy exercise or during exercise at home. I mean, not that exercise will kill everyone, but doing a graded exercise, gradually escalating the intensity, a level of intensity of exercise over time helps rather than all of a sudden, increasing and doing an unaccustomed level of exercise. So gradually increase the intensity and don't overdo anything, especially exercise all of a sudden. So anything that you're adopting, like when you're unaccustomed to certain level of physical activity and you are trying to do that all of a sudden, certainly increases the possibility of sudden cardiac arrest. How long does it take to recover from having a stent? If stenting is done for an elective procedure, for somebody who did not had an attack, it's an incidentally identified identified for a minimal symptoms. They recover. I mean, they get discharged in a day or two, and probably within a week, probably max a week rest, and they can get back to their routine lives within a week. In case stenting is done after a major accident like a major heart attack, probably I would recommend taking a physical rest for a month, and then gradually start doing physical activities and gradually escalate the level of physical activities. That helps. So it depends on what extent the underlying problem is and what extent the damage has happened. So if there are no more questions, let me conclude. Hello, sir. How should we monitor the fluid intake for geriatric patients? So, fluid intake for the geriatric patients. I mean, it's a geriatric patients are very tricky patients. Any slight excess, they end up in multiple problems. Like they end up in worsening heart failure, getting breathless, sodium going low, or sodium going low. I mean, multiple issues happening, and creatinine worsening, or kidney failure happening. So multiple issues do keep occur, especially in geriatric patients. So, very tricky and very difficult to monitor. One strong guidance should be thirst driven. Don't jump, don't take unnecessary and unwanted or excess fluid intake beyond the level of thirst. And especially when geriatric patients have underlying heart failure, make sure they are taken to a physician often, at least once in a month, to make sure they are in the right track, because their requirement of drug keeps changing very often, no time, for the reasons, the kidney starts worsening, yeah, their age, and so the drug doesn't get metabolized effectively, so levels in the body keeps changing. So multiple issues do pitch in geriatric patients. So probably, the only way or easier way to sort it out is keeping a track of them, quite cautiously, supervising them and carefully monitoring them, and regularly taking them to a physician. Often, at least once in a month, or even lesser than, even more frequently, in case they have a significant problem. Only that's the way to go in handling geriatric patients. They are very tricky subject. They are very difficult subjects to handle. What is cardiac rehab program? Yeah, it's a cardiologist and physiotherapist, dietitian, all put together should collectively work in gradual recovery, in aiming at the gradual recovery of cardiac patients who suffered an attack or who suffered heart failure, just stabilized and recovering, to assist them in their improving cardiac strength and cardiac remodeling, and by guiding them with their daily physical activities, guiding them with with their dietary patterns, and guiding them with improving their psychological health as well by involving a psychiatrist, and of course prioritizing the drugs. I mean, by appropriately dosing the drugs and matching the requirements, keeping them in close track by a cardiologist. So it's a vertical approach, multidisciplinary approach. So cardiologist, both interventional and preventive cardiologist, clinical cardiologist, physician, dietitian, and physiotherapist, and psychologist or psychiatrist. I mean, they all play a role together in improving overall physical and mental well-being of a cardiac patients. So that program is cardiac rehabilitation program. Unfortunately, in our country, it is existent in a very few centers. So if there are no more questions, let me call it a day. And thank you all for being so patient, and thank you all for posting questions and making the session more interactive. Thank you.